Less than 40 miles from this station in Winston-Salem, a professor is doing something that has never been done before, finding ways to treat children with disorders before they are born.
Ritu, Martin, Caroline, Brady. Those are names of just a few students leading the charge for the next generation of medical pioneers with Atrium Health Wake Forest School of Medicine's biomedical graduate program. The leader showing them the way, Dr. Graca Almeida-Porada.
Did cells need to be fed, or did you need to come to the lab, or?
Yeah, I'll probably need to come in. I can probably feed them on Wednesday and then once again on the weekend.
They are here, they work hard, you know, they really are my arms in a lab, and so they make me proud every single day of my life.
She's a trained medical doctor, but these days she finds herself in a lab, guiding students through breakthrough research as a professor at the Wake Forest Institute for Regenerative Medicine.
I stopped being a physician and I switched to be an investigator. I wanted to find a different way to treat these children.
Dr. Almeida-Porada says she got into research to find a cure for children with genetic disorders. She says 380 million people have a genetic disorder and 30% die before their 5th birthday without diagnosis.
One thing that is different from other labs or other researchers is that we try to treat these children before they are born. So like what Martin is doing is developing a cell therapy. So we use cells actually derived from the placenta.
Dr. Almeida-Porada says she needed to leave the doctor's office and be the change in the lab.
So I trained at a time when HIV was very prevalent because we didn't have the appropriate tests. And telling one of these patients that they had contracted HIV from a product, it was painful.
Dr. Almeida-Porada says not having a lot of treatment options in the late 80s was a tough time. Today, her students tackle genetic issues head on.
And she's trying to predict when we infuse AAV, that is a virus that is used in gene therapy, that what happens to the liver. Does this work? Will it make an impact? And then we start studying and also educating the next generation of scientists. I think it's so important to teach them how to think, how to fall in love in science. Okay, so to keep the cells, they don't like to be outside. So my dream is to find cures for these genetic disorders.
I will say each one of those folks, I bet you, if they took an IQ test, they would get the highest score on the spectrum because the amount of science and math and everything that they were doing, I was sitting in there like, huh? I have degrees, I've been to school, I promise you. But when I was in that, I said, this is rocket science, okay?
I mean, that's it. When you get to the genetic level, you know what I mean? When science starts talking about treatments on a genetic level and even before children are born, like that's when science loses me, and I just have to sit there in awe and go, this is awesome. I don't understand it, but it's great.
Same. I'm just glad we have people who do understand it.
Yes.
It's just amazing to just see technology just evolve.
Oh, it's crazy. I mean, I have a friend from college, and his wife was pregnant, and you do this genetic testing beforehand if you choose to, and they found out that their baby was going to have spina bifida. They were able to go in while she was still pregnant and do a procedure on the baby, or like in utero.
What a blessing.
Yeah, I mean, it's just, it's crazy that they are able to do that these days, and I can't even imagine actually what it's going to be like in a few years. But
no, Stacy, that's exactly what she does. That's literally a perfect example of exactly what she does. And she was actually a part of the research group, which was the first people to ever do that on an individual way back long ago. She was a part of that very first group. She was a part of the groundbreaking research to do that. That was a perfect example. I didn't have an example to provide in the story, but you know, we got Stacy for it. That was a great way to break it down, but she's doing amazing work.
yeah, I mean, so incredible. They're saving lives, and they're going to continue to do so for years to come. And it's all happening right here in our own backyard.
Some incredible movers and shakers here in the Triad.
Yeah, love that story, Monique. Thank you.